views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.
Good day. You are listening to Ability Radio. I am one of your hosts, Amelia Hedley-Lemont of the Disability Rights Center of the Virgin Islands. And today we are being joined by what is referred to as one of our partners, the University Center of Excellence on Developmental Disabilities, as well as one of our advocates from the St. Thomas office from the Disability Rights Center. So I'd like to welcome Shamika Thomas. Good morning, Executive Director of VI, what we call UCEDD, UCEDD, University Center for Excellence on Developmental Disabilities, and Shammi Carr, Advocate for the Disability Rights Center of the Virgin Islands. So good morning to you both, ladies.
Good morning. Good morning.
Well, let's start with the university. Shamika, let me call you Shamika. We go by first names.
Shamika is fine.
Okay, thank you. Tell us what the University Center for Excellence in Developmental Disabilities stand for. What is it?
So it is a program that is a national program. It is a national program that's affiliated with the Association of University Centers on Disabilities. And it is a national program that is in every U.S. state and territory. There are about 68 UCEDDs among the United States and its territories, including the Virgin Islands. And we have two centers, one in St. Thomas, one in St. Croix, that are housed under the School of Education at the University of the Virgin Islands.
Now, do you need to be a student at the university in order to get the services that your office provides?
So even though we're stationed under the university, we are a community-based organization, and we try to bridge the gap as far as disability-related information between community and the university.
Okay.
So no, you do not need to be a student per se. You more or less need to be a person with a disability, an advocate, a family member of a person with a disability to utilize our services.
Okay. Well, tell us what kind of services your office offers.
So under the UCEDD, we provide supports for issues such as early intervention, healthcare, transition from school to work, employment, housing, and assistive technology. So we have different programs where we disseminate information, we do trainings so that people can become familiar with disabilities, sensitivity towards people with disabilities, and supporting persons with disabilities.
Do you charge a fee for your service?
Give services free of charge for the assistive technology services. Those are direct services that we provide to persons who may need to use assistive technology to have some sort of independence. Monies are funded through grants, so we're able to provide the services for free to the community.
All right. Now, that's a language that is used within the disability community. What do we mean by assistive technology? Give me some examples, please.
So assistive technology is any device, anything. It could be high-tech or low-tech that allows a person to be able to function as independently as possible. So an example of a high-tech device would be something like a motorized wheelchair or a iPad that has apps that could allow persons with visual impairments to be able to use a screen reader or any type of application that would allow them to be able to do the things to read, so they're able to read the internet, websites. And then low tech would be something as simple as a magnifying glass to allow somebody who might be low vision to be able to read a book. And
okay, so the
glasses could be considered AT, hearing aids, things like that.
So these are items that you would have in stock in your offices? Is that what you're saying?
So we don't have them in stock, but we're able to point you in a direction so you're able to acquire these devices. If you are low vision, and low hearing, you might be able to qualify for the I Can Connect program, who may be able to pair you with an appropriate device so you're able to have as close to independence as you possibly can.
Okay. Now, you mentioned the wheelchairs, and that's what's referred to also as medical equipment, right? Durable medical equipment. Do you have those kinds of devices on hand at your office?
As a matter of fact, we do, thanks in part to a partnership with First Bank. Thank you, First Bank, for your wonderful donation. We were able to acquire durable medical equipment such as walkers, canes, wheelchairs, some shower caddies, and we're able to provide them at no cost, or the community is able to loan them at no cost, temporarily or long term. And it's on our system where we're allowing you to use the equipment, and we're asking that you take care of the equipment for as long as you need it. And when you no longer need it, return it as best a condition as you can, so that we're able to pay it forward to another consumer who may need the same device.
Okay. Tell us a little bit about Shamika. How did you come upon this position?
Well, this position chose me really. I was in the public health sector, but more from a healthcare perspective. By training, I am a biologist and a public health professional who specialize in women's health issues. And I met with Dr. Yegan Haptis, who then chose me to be the program coordinator for a number of years. So from 2016 to about 2022, I served as the program coordinator for VIUCEDD. And as the position became vacant for the executive directorship, I was asked to be the interim director so that there could be continuity of programs, as I was the most familiar with the programs. And then from there, it became a permanent position.
Oh, excellent. Excellent. So you've been in this capacity since 2022. Is that correct?
Yes, ma'am.
Okay. Shammi Carr.
Yes. Good morning. Yes.
Good morning. Now, you can tell us, please, about the role of Disability Rights Center of the Virgin Islands and the VI University Center for Excellence in Developmental Disabilities. Since you've worn both hats, haven't you?
Yes, I have. It's actually a pleasure to be on the show because I too worked with Dr. Haptis, and I too was in the same position as Shamika as program coordinator. So I'm very familiar with VIUCEDD. It's a pleasure to now work with them as partners. And DRCVI, as you mentioned, we have what we call these partners or sister agencies. And so definitely VIUCEDD is one of those sister agencies that we look to collectively work on behalf of people with disabilities so that we can make that systematic impact throughout the territory. And that's why we do these partnerings, and that's why we have these very close relationships. Regarding Disability Rights Center, this is an agency, again, that's been around for many, many years. I believe 1977. Would that be correct, Amelia?
That's correct.
So a very long time. And it's interesting how it evolved, because it was meant to be, well, not meant to be, but it became a protection and advocacy program because of a lot of different maltreatments and exposés that were going on to expose the treatment of people with disabilities in institutions and other congregate settings. And so the Disability Rights Center then became part of that network. VIUCEDD is part of a large network, and so are we. And that's why our tenant is to protect the most vulnerable. And we do that both through individual advocacy, and that can include information referral. It can include short or long-term assistance. It could be just some information or materials that they need about their rights. And then sometimes we do legal advocacy, and we do have attorneys on staff that are able to then continue the higher level of protection of people with disabilities that they're dealing with. I myself, I'm what they consider a lay advocate, and I do work a lot with parents, and also I work a lot with employment. So that's just a little bit about me, and the relationship that we've had with VIUCEDD has been long standing, and we continue to look into the future for those partnerships to go on.
Well, I know, for example, that the Disability Rights Center and the VIUCEDD had done a lot of training, right? And there's something having to do with what?
Mm-hmm.
Americans with Disabilities Act. What else?
Mm-hmm.
What other kinds of trainings has the organizations focused on?
Sure. Shamika, you want to start, and then I'll add anything to it?
Sure. So we have several trainings that we do throughout the year, one of which are our continuing education trainings, where we talk about different aspects of disability. We talk about aging in place. We talk about nutrition, the importance of nutrition. We talk about ASL, all the things that could help bridge the gap for our community to be able to support persons with disabilities.
So how are these trainings done? Is it done virtually or at a location? How does that done?
So pre-pandemic, some of our trainings were offered in person here at a university. However, as things changed and Zoom became more prevalent, we have now begun to really champion our online platforms and our virtual platform because it allows us to expand our reach. So sometimes we may even have persons who are non-local, who might be experts in the field, who might reside in the States, so in the United States or other UCEDDs who may be able to present on a particular topic of interest so that instead of paying for accommodations and travel, they're able to access that information in real time via a virtual platform. So most of the things that we do now, trainings have been offered virtually.
Okay, and how's been the level of participation in your estimation?
So we get mixed reviews. So sometimes people prefer the in-person. So what we can do in person, we try to continue to do in person. And the things that we absolutely feel it's best to have as virtual, we continue to offer that virtually. So each activity that we do, we weigh it out as to whether the virtual or the in-person would be the better option for that particular thing. And then we move accordingly based on previous data from other events and activities.
Shammi, you have anything to add to this?
Sure. I want to just point out maybe 3 things that we've done this year that I think has been just stellar. And I know Shamika mentioned in terms of the ADA, but the ADA Expo that we do, and it's a large collaboration, of course, that includes both of us, our agencies, is kind of growing by every year. And so it's been great to see that collaboration. And again, that's within a very large purview of other disability organizations, including the ADA coordinator for the territory, Julie Henley, Vocational Rehab, Independent Living Center. So the ADA Expose, and that's a FYI for people to look forward to next year for sure. We, of course, that's done on both islands, and that's done in person. And that's an event that could really only be done in person because of the nature of the event and also the level of collaboration. So we're always excited when that comes around.
Which is
recently,
July, correct? Give
July,
a plug for the month.
July 26th to be exact.
Okay.
But yeah, July. And recently, VIUCEDD we partnered with VIUCEDD to do a sign language training. And Shamika, I know you guys it was almost breaking the Zoom. There were so many people who were joining, and that was a great collaboration. There was hundreds of people who wanted to learn about sign language. And most people know in the community that VIUCEDD is one of the leads on teaching sign language classes for the community. So that was a great partnership. And just to see the level and the breadth of interest that people had was just wonderful. And I want to mention also very recently, matter of fact, this month, we collaborated on an event that included, again, talking about deaf awareness and the fact that this community has a fair amount of folks who are deaf and hard of hearing. And DRCVI actually has been a good support and almost an advocate for the deaf or hard of hearing, Virgin Islands Deaf or Hard of Hearing advocate group. And so recently, VIUCEDD, DRCVI, and the Deaf Hard of Hearing group did a celebration, and it was just wonderful. And it really shows the strength of the collaboration, and it really shows the strength of the system advocacy that we're all trying to do so that it doesn't just help one person, it helps several persons. And so through these trainings, this is what I see as a way to, again, not only do the partnerships, but then to see the impact that it has on the community.
And just for, again, clarification, whenever we say DRCVI, we mean Disability Rights Center of the Virgin Islands. And when we say UVIUCEDD, we mean University of the Virgin Islands, University Center for Excellence on Developmental Disability. So, one of the things that was also included that I was quite intrigued by was that there's a LEND program. Shamika, can you tell us about that and what it means?
Yes. So LEND is Leadership Education in Neurodevelopment and Related Disabilities. So I know we have a lot of acronyms and they're quite lengthy to say.
Yes.
Twisters almost. So we just say LEND, L-E-N-D, but it's Leadership Education in Neurodevelopmental and Related Disabilities. So it's an interdisciplinary leadership training program for professionals in varying disciplines who are interested in advancing disability services within their respective fields. So at this time, we are partnering with the Westchester Institute for Human Development, and that is in New York. They are one of the top providers of LEND in the UCEDD networks. And what it is, it's an annual training program. So it spans the time frame of 2 semesters. So that's a fall and a spring. And we have 2 trainees from the island of St. Croix who are in various disciplines, from education to human services to medical practitioners who are just interested in advancing disability services, ideology. They could be a family member or a person with disability in and of themselves. There is an educational requirement. However, those are waived for persons who are self-advocates. So you don't necessarily have to have a degree if you are a person with a disability and you are a self-advocate. And as I said, it spans various disciplines: health advocacy, health administration, nursing, nutrition, whatever, public health. And it's from September to about May annually. And in addition to 2 trainees from Puerto Rico, they join in virtually with those who are in the Westchester Institute so that they're able to have a cohort of LEND trainees. And basically, they conduct research on issues related to disabilities and they present that. They go for they actually go to Westchester for a orientation, get acclimated with the program. Then they focus on research. They do a lot of training around disability related issues. And at the end of the program, they graduate, so to speak, and they present their research to policymakers that are in New York. They do a vast amount of activities to culminate the experience. And then sometimes they're even offered to make presentations and poster presentations to other conferences that are related to people with disabilities. So it's a beautiful program. It is intense. However, it is well worth it if you are interested in learning more about disability-related topics to bring back to your respective field of interest.
Have you had much in the way of participation from, people in the Virgin Islands on this program?
Yes. So over the last few years of this partnership with Westchester, we've had maybe about 6 trainees who have successfully completed the program. It is college course credits. So if you wanted to go ahead and get a certificate or a degree in disability-related studies, you can use those credits towards that degree. However, most of the trainees do the training program and go back into their respective disciplines. So right now, we currently have 1 trainee on the island of St. Croix who have just begun, and she is making so much headways that I'm so happy that we are able to still continue to have representatives from St. Croix attend these LEND programs.
Okay. All right. Shammi, is there something else in this regard? And then there was another issue regarding professional development. You can jump in on either topic.
Well, I'm very familiar with the LEND program. I think it's just a fabulous program to be able to support and grow a leader in this community. So what Shamika was talking about, this interdisciplinary, is to be able to have different facets of being that advocate. And again, working at VIUCEDD, the LEND program was going on then. And I always thought it was a stellar program. It gave someone that opportunity to be that leader, to have that influence, and to, again, grow within their own advocacy skills. In terms of other professional development opportunities, again, VIUCEDD being kind of a foot in the in the community and then a foot in the academia. And so the LEND program is a nice balance where there's some academia, but again, it's affecting the community. And so I do admire VIUCEDD for that. Their kind of dynamics of the project, because they're boots on the ground in the community, but they're also trying to influence academia. And I've worked in academia, and it's just that people want to be able to really know what's going on the ground. Let's not be ivory tower about this. Let's make sure that we're listening to the people. And that's why I appreciate VIUCEDD what they do, because they they bring that voice of back to the community. And again, a good example, voices that count. That's something that cannot be done at an academic level. This is a situation where we're talking about what are the real issues in the trenches? What are we trying to change? And can our voices be heard in making those types of changes? So again, with VIUCEDD having kind of two components, it's a great way to be able to still do systems advocacy, boots on the ground, as well as academia. But again, not getting into an ivory tower system where people cannot relate or people don't know. They're kind of distant from what the situation's at.
Well, you mentioned voices that count, and I was always I was under the mistaken impression, shame on me, that voices that count was pretty much only done during election year, because I know that's at a time when, the university would sponsor an event and the respective, candidates in whatever capacity would come and present and respond to questions from the disability community. But Shamika corrected me. She says, no, Voices That Count is an every year event. So Shamika, can you tell us more about this Voices That Count component of your work?
So Voices That Count is a very involved activity. It's probably one of the most involved activities that we do here at VIUCEDD, because there's so many moving parts. There's a community aspect. There is a policy making aspect. There is a, organization aspect that we're having to manage. But ultimately, the goal is to allow persons with disabilities, their caregivers, their advocates, to be able to meet with the persons who create the policies that impact us all and have real conversation about the issues that impact persons with disabilities in the Virgin Islands. So it's one of my favorite events, because when the persons who create policies come, they are enlightened to all the things that persons with disabilities face from a more realistic standpoint. Sometimes if it's not your reality, you could be a little bit removed, and not intentionally, but when you're seeing the people, you're hearing their concerns in real time, and you're hoping to advocate for change if they're selected as our legislators or our governors, that they're keeping the issues in mind from the beginning. So that.
What do you do during a non-election?
Over the years.
What do you do during a non-election event?
So non-election years, we usually bring someone. It could be someone from the States. It could be local advocates who are able to present on how persons with disabilities can advocate for themselves at different levels. It's usually always geared towards improving the advocacy efforts locally.
And those events are usually done in person, correct?
Yes. So they're always done in person. The only time we did not do them in person was during not to trigger warning, but the pandemic.
Right.
During COVID-19, of course, there were stipulations to meeting in person here at the University of the Virgin Islands, where we typically host these events. So because of that, we were unable to meet for about a year or two as we navigated the pandemic. However, we did interview persons who were aspiring for seats in the legislature so that they were able to still communicate with persons with disabilities, and we aired it on WTJX. And so now that things have settled down from COVID we're trying to revamp our in-person offerings and the frequency to which we have them.
Okay, well, we have a couple minutes left, and what I want to make sure we do is find out, or let our audience know, how do we get in touch with Disability Rights Center of the Virgin Islands, and how do they get in touch with the University Center for Excellence in Developmental Disabilities? So, Shamika, we'll start with you. How does somebody get in touch with your office?
So we have a presence on Facebook, and it's the VI University Center for Excellence in Developmental Disabilities. So that page is pretty active. And you can also visit us on www.viuced.com, and it will automatically reroute you to our website. So all our contact information is on the site. So you're able to speak with any of our staff members that may be a part of the service that you're interested in.
How about a phone call?
Yes,
Just asking.
Our phone numbers are listed there on the website as well under our contact.
Okay. You don't know the phone number at the top of your head? At least give me one number.
Oh, so my telephone number, because I don't call myself, so give me a second to think. So it's 340-693-1406 if you're just wanting to get basic information or just to know who on staff might be the best person to contact about a particular issue. And we are able to direct you. And then you can also call 340-693-1322. And that would be Miss Khalifa Thomas's extension, or her number rather, where she does a lot of the coordinating of events. So she will probably be the best person to speak to as it relates to activities and projects.
Sounds good. Shammi, you just give us the number. We only got a few seconds left.
Okay. St. Thomas numbers, 340-776-4303. St. Croix, 340-772-1200. You can email us at info@drcvi.org. You can go on our website, drcvi.org, and we have several social media, YouTube, Facebook, and Twitter.
You name it. Thank you both so much for such a wealth of information. Folks, thanks again for listening to Ability Radio. Till the next time.
The views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.